Every year, thousands of lives could be saved if people knew the early signs of a heart disease. Are you aware of the subtle warnings your body might be giving you right now? Heart disease is the leading cause of death for both men and women over 50 in the United States. Over 695,000 Americans die from heart disease every year. That means 1 in 5 deaths. But who gets heart disease? Heart disease doesn't care who you are. It kills more people than anything else, whether you're white, Hispanic, or Afro-American. And nearly half of all Americans could get it, and things are getting worse. But even though it can be deadly, most folks can prevent it by making some changes in how they live, starting early while they're still healthy. Do that, and your heart could keep on ticking for years longer. What are the reasons of heart disease after 50? Poor blood supply to extremities. Narrowing of the arteries that bring blood to the rest of your body ain't the same thing as heart disease, but it could mean your risk of having a heart attack is way higher than it would be otherwise. This can happen when cholesterol and fatty gunk builds up on the walls of your arteries. If your legs ain't getting enough blood, you might have pain, achiness, tiredness burning, or just plain discomfort in the muscles of your feet, calves, or thighs, and symptoms that kick in when you're walking or exercising, then fade after a few minutes of rest. Numbness in your legs, or dogs when you're just chilling. Your legs could also feel cold and look pale. Fatigue. Feeling super drained lately? It's probably just your body begging for some extra rest. But if the exhaustion is next level, it could point to something more serious like heart issues. Watch for these clues. You're wiped beyond the norm, can barely drag through your regular routine. For women especially, mega fatigue can hit before or during a cardiac event. Out of nowhere, you feel so weak you can hardly function. If this sounds familiar, talk to your doc, and better safe than sorry when it comes to your ticker. A few simple tests can give the all clear or catch problems early. Fast or uneven heartbeat, palpitations. If your heart can't pump blood as well, it may beat faster to try to keep up. You may feel your heart racing or throbbing. A fast or uneven heartbeat can also be the sign of an arrhythmia. This is a problem with your heart rate or rhythm. Swelling in the legs, ankles, or feet. If your heart's not pumping properly, blood flow through your veins slows way down. Then fluid starts building up in your legs and makes the tissue swell up. Doctors call that edema. You also might bloat or gain weight around your belly for the same reason. It's because circulation's getting blocked, so liquids pool up instead of moving through your body like they should. Coughing or wheezing. Coughing or wheezing that doesn't go away can be another sign that fluid is building up in your lungs. You may also cough up mucus that is pink or bloody. Shortness of breath. When your heart not ticking right and can't push the blood good, it gets all backed up in the veins between your lungs and heart. Then fluid starts seeping into your lungs, making it tough to catch your breath. That's one way heart failure shows itself. You might feel short-winded if you're moving around, even just sitting still. Or when you're lying flat on your back, it may even wake you from sleep. Chest pain. Chest pain can feel real uncomfortable or hurt in the front of your body, going from your neck down to your upper stomach area. There's actually a bunch of stuff not related to your heart at all that can cause chest pain. But chest pain's still the most common feeling when blood's not flowing right to the heart or you're having a heart attack. That type of chest pain's called angina, and chest pain happens when your heart's not getting enough blood or oxygen. How bad the pain is and what it feels like can be real different from one person to the next. Just because it hurts more for one person doesn't always mean their heart issue's more serious. Some folks might feel real bad chest pain, while others just get a little uncomfortable. You could feel like an elephant is sitting on your chest, or your heart is in a vice grip, or maybe it's a sharp, burning kind of pain right in the middle of your chest. It could be under your breastbone or spreading out to your neck, arm, stomach, jaw, or upper back too. If it's angina, the pain tends to come on when you're active or feeling stressed emotional-like, and then it goes away when you rest up for a spell or take some nitroglycerin medicine. Bad indigestion can make your chest hurt something fierce as well. Ladies, older folks, and diabetics may not feel much or any chest pain at all. Other people might have different signs instead of chest tightness, like being real tired, short of breath, weak all over, or looking pale or bluish, getting weak with skin color changes. More heart attack clues can be straight up freaking out, passing plumb out, getting dizzy or lightheaded, throwing up or getting queasy, feeling your heartbeat going nuts, or beating too hard or fast or uneven. gasping for air, and sweating buckets. What are some risk factors for heart disease? There's a bunch of things that can raise your chances of getting heart disease. Some you can change, some you can't. The CDC says about half of Americans have at least one risk factor. A few big ones are high blood pressure, bad cholesterol levels, smoking cigs, being overweight, and not exercising enough. And for instance, smoking's a risk factor you can control. The National Institute of Diabetes and Kidney Diseases says lighting up doubles your odds of heart issues. Folks with diabetes might also be more likely to have heart problems, since high blood sugar raises the risk of stuff like angina, heart attacks, strokes, and coronary artery disease. If you've got diabetes, keeping your blood glucose under control can reduce the odds of getting heart issues down the road. Having both high BP and diabetes together amps up your cardiovascular disease risk more than just one or the other. Risk factors you can't control. Other things that make you more likely to get heart disease are family history, your ethnic background if you're a guy or gal, and how old you are. You can't change those things, but keeping an eye on them is smart. It's especially worrying if someone in your family got heart disease young, before 55 for dudes and 65 for ladies. Folks who are black, white, Asian, or Pacific Islander are at higher risk than Native Americans, Alaskans, and also fellas are just more prone to heart trouble than ladies overall. The CDC says more guys get it. How can over 50 prevent heart disease? Some risk factors of heart disease can't be controlled, like your family history, but it's still important to lower your chance of developing heart disease by decreasing the risk factors you can control. Now, shooting for healthy blood pressure and cholesterol is step one for heart health. Blood pressure is measured in millimeters of mercury. Good blood pressure is under 120 systolic over 80 diastolic. Systolic is the pressure when your heart squeezes. Diastolic is the pressure when your heart chills between beats, and higher numbers mean your heart's working too hard, squeezing blood through your veins. What cholesterol level you should aim for depends on your risk factors and heart history. If your risk of heart problems is high, you have diabetes, or already had a heart attack, your target will be lower than someone at low or average risk. If you want to avoid heart problems down the road, there's some lifestyle changes you can make. Doctors say getting 2.5 hours of exercise each week can go a long way. Aim for 30, 60 minutes most days. Check with your doc first though, especially if you already have heart issues. And other things that can help are quitting smoking. Nicotine makes it hard for oxygen to flow, and finding ways to manage stress. Chronic stress takes a real toll on your ticker. Trying to do all this at once can be tough. No need to overload yourself. Just talk to your doctor about what change would give you the most bang for your buck right now. Even small steps are good steps when it comes to your health. There's lots of ways to reduce your chances of heart troubles. It's worth learning more about them. Takeaway: a lot of folks, we're talking almost half the population here, have a higher risk these days for heart problems down the road. And that number keeps going up too. But here's a silver lining. Making some healthy lifestyle shifts can help avoid or manage heart disease in many cases. Now, real talk, it ain't always easy fitting in those lifestyle tweaks today, what with how busy all of us are, but it's so worth it. And if you show your heart some TLC now, chances are it'll return the favor when you're older. So do your heart a solid. Take a breather and go for a walk. Grab some veggies or fruit next snack time, and try getting to bed a little earlier. Little things can make a big difference over time. Your heart will thank you.